Hello, my name is Erin Anstadt, and I am a fourth-year resident at the University of Pittsburgh Medical Center, and I'll be presenting my project, a randomized controlled trial evaluating the use of 3D printed models in craniosynostosis education. Active learning strategies encourage students to engage with their environment and with each other to build knowledge. They often take the form of simulations, case studies, debates, or peer interviews. There is strong evidence that active learning methods benefit learners across disciplines. In this study, we aim to analyze outcomes of incorporating 3D printed skull models into medical student didactics to promote active learning and demonstrate principles central to craniosynostosis. To accomplish this, medical students enrolled in a plastic surgery elective were randomly assigned to receive a traditional lecture on craniosynostosis alone, this constituted the control group, or to receive the same lecture plus attend a hands-on session, this was the intervention group. In the hands-on session, the instructor used 12 3D printed skulls that were created from craniosynostosis patient CT scans to model different types of craniosynostosis. Each skull model was described, then passed between students who could individually view and compare them. 3 of the 12 skulls were postoperative models that demonstrated skull shapes following craniosynostosis repair, providing a physical demonstration of the surgical approach. To assess effectiveness of the educational intervention, students took a 23-question test evaluating their knowledge related to craniosynostosis pathology, physiology, and management at 3 time points. All students were tested prior to the course. The control students were then tested a second time after the lecture alone, and the experimental group was tested after the lecture and hands-on session. All students were again tested 3 weeks later in an attempt to understand knowledge retention. It should be noted that after taking Test 2, the control group was offered the opportunity to participate in the hands-on session, so the retention test results were analyzed for the group as a whole. 21 students total were enrolled. 11 students were randomized into the control group, while 10 were randomized into the experimental group. There were no significant demographic differences between groups. The session in all lasted 25 minutes. On Test 1, there were no significant differences seen in the mean overall score between groups, with the control group scoring 61% and the experimental group scoring 57% correct. On Test 2, both groups had a significant increase in the mean number correct. The intervention group had a significantly higher mean score compared to controls, with 92.1% correct versus 82.6% correct. Further, 100% of students in the intervention group, compared to 90% of students in controls, could correctly define craniosynostosis on Test 2. In terms of anatomy knowledge, the intervention group correctly identified an average of 2 additional sutures on Test 2 compared to Test 1, whereas controls identified only 1 additional suture. They also identified 4 out of 5 distinct craniosynostosis head shape patterns on Test 2, significantly more than on Test 1. On the knowledge retention tests, the mean score for the group as a whole was 89%. On average, students correctly identified 4 out of 5 cranial sutures, 4 abnormal head shape patterns, and 4 symptoms associated with intracranial hypertension. The estimated cost for materials and labor associated with making the models was $250 per model. The foundation and focus of discussion for the small group session was the skull models, so while we have a small sample population and we cannot directly assess causality, specifically between the models and test score improvement, we feel that the skull models largely contributed to the learning gains made during this time. We feel 3D printing is a relatively inexpensive tool that can be increasingly applied to education in craniofacial surgery for medical students and residents, with high satisfaction rates expected and good learning outcomes over time. Thank you.